Hi guys, so this is video number 2 for our video discussions, and I wrote it down and printed it out because I believe it would be easier to just have it written down here instead of just coming up with it as I go. So here we go. Nora Blum's TED Talk titled "A Call to Change" gives a powerful description of depression. It is deep within, and it is felt everywhere in the body, yet it is often invisible to others. For the sufferer, it is an emotional toothache every day. Ms. Blums points out that a physical injury or illness is self-evident. So if you have a broken arm or a viral infection, the doctor can see it or detect it. The condition is plain to the eye, or it can be confirmed through blood work. For the most part, mental illness is not like that. Even so, depression can also be a lethal illness that sometimes finds its ultimate expression in self-harm and even suicide. Technology today can be a most useful tool in treating physical or mental problems. One thing we learned from COVID is that FaceTime, Zoom, and other platforms can make the mental health provider more accessible even during a pandemic. Even our phone can provide easy online access to psychiatrists, psychologists, and counselors, no matter how isolated the patient may be. Because of the COVID experience, many patients are choosing the convenience of virtual sessions, avoiding the trip to a provider's office. I personally have done this and feel that I have lost nothing in seeing a therapist online rather than in the same room. I believe that Ms. Blum's TED Talk is made even more powerful by touching on some of what Professor Brené Brown covers in hers. So I decided to combine the two TED Talks because I believe that there was two really great ideas that I wanted to talk about from both of them. For social work, Professor Brown rejects the idea that if you can't measure it, it doesn't exist. That may be the case for math and physics, but the concept of exact measurement has little to do with human feeling and predicament. Dr. Brown points out that depression is often a feeling of disconnection and isolation based on an underlying sense of shame. Depressed people often feel that they are unworthy of love and respect. The goal for social work is partially to just connect with yourself and others, to break the cycle of shame and the isolation it provokes. Often people visit a therapist as a starting point in connecting, first with a therapist, then expanding to connect with a wider community. It takes courage to speak from the heart about one's brokenness. Expressing vulnerability is thought of as admitting defeat rather than as a first step in recovering from crippling shame. A good social worker would, in the role of counselor, provide a person seeking help with a safe, non-judgmental space to deal with issues of shame, hopelessness, which are the manifestations of depression and anxiety. An important aspect of social work, beyond finding financial resources, is to listen and to understand. There is a challenge to the social worker that is not discussed in the TED Talks, and that is the risk of emotional burnout. It is difficult to process the emotional pain of others without absorbing it yourself. In the end, you can only be a safe place for others to come unless you are at peace with yourself. You can't provide what you don't have within you. So in social work, we must look out for our own mental well-being. This is what I got from the TED Talks we watched this week. So, thank you.